This segment of Coastlife is sponsored by Beebe Healthcare.
Well, Coastlife, we know that there have been a lot of people moving into Sussex County and especially around our coastal communities. And with that, also increases, some of the medical needs and services that we have. And that includes cardiology. We've got a new doctor to introduce you to with our friends at Beebe Healthcare. We've got Dr. Andrew Foy joining us, a new cardiologist with Beebe Healthcare. So, doctor, introduce yourself a little bit. Tell us about yourself and a little bit of your experience and what you're bringing back into Sussex County.
Thanks. My name's Andrew Foy. I am a new cardiologist with Beebe Cardiology Lewis. I am from Delaware, but did my training and my early career in Pennsylvania. Went to med school at Jefferson, and then did my cardiology training and have been working for Penn State Hershey Medical Center for the last 10 to 15 years or so.
Nice. Well, we're glad to have you here in Sussex County and taking care of our coastal communities here. So what are maybe some of the signs for somebody who, needs to come see a cardiologist? Is there like a right time in your life that it's a good time to check in? Does something need to be wrong? When should somebody come see you?
So in general, cardiologists diagnose and treat all cardiovascular conditions. We also help manage risk factors that can cause cardiovascular disease and worsen outcomes for people with cardiovascular disease. When is it right to see a cardiologist? I would say anytime somebody has a concern about their cardiovascular health, whether they have diagnosed cardiovascular disease or not. As I said, we do manage risk factors that cause cardiovascular disease, so there could be a lot of reasons why somebody would see a cardiologist.
Sure.
I wouldn't say there's any particular time when somebody should, as far as like screening goes, but certainly we see all, adult patients of all ages who have either cardiovascular disease or concerns about, having cardiovascular disease.
Makes sense to me. I also know that Beebe Cardiology is sort of one piece in a larger puzzle when it comes to the Cardiovascular Institute. Can you tell us a little bit about that as well?
Well, this is a new initiative, and yes, Beebe Cardiology Lewis is going to be part of the Cardiovascular Institute, which is going to involve a lot of different specialties within cardiovascular medicine and also, I guess, cardiothoracic surgery as well.
Nice. Now I know that cardiology, cardiovascular, there's some big terms, but you have some more hyper specialties within that. What are some of the things that you specialize in when it comes to cardiovascular health?
So for my most of my time at Penn State, I was involved in research on diagnosis and treatment of coronary artery disease, and also specialized in the management of patients with hypertension, with benign forms, and also with what we call resistant or renovascular forms of hypertension.
Gotcha. So I know in this area, sometimes it can be hard to get in and see a doctor, but you still have some availability, some capacity. So for folks who maybe need to see a cardiologist or they've been looking for a new one, what's the best way for them to make an appointment with you?
They can just contact my office. We can get people in at this point pretty quickly.
Perfect. Welcome back into Sussex County, and we're glad to have you here, Dr. Foy. And I know that you're going to be taking care of a lot of our neighbors here in our coastal communities. So thanks for coming in today.
Yeah, thanks for having me.
Of course. Coming up on Coastlife, though, we talk about it all the time, how Coastal Delmarva has such generous hearts, and we've got some generous donations to celebrate when we get back.